Hi, welcome back. And welcome to all those that are new to North Star Physical Therapy Podcast. I'm Dr. Shirlea North. And today we are going to be talking about the combination of my two specialties and how they really do interrelate. And so those are lymphatic health and pelvic health. And this is going to be inclusive of all adults, really of all people, right? But I mainly treat adults. So I just want to make sure any language that I'm using when we talk about pelvic health is going to be a little bit more on the binary side of things, just for pure anatomical identification. So just giving you a little bit, we're going to have a little bit of an anatomy lesson, but I wanted to really share that the importance of both of these areas of the body, and not just area, but of the systems, right? And so with my two specialties as a physical therapist, treating anybody with lymphatic or pelvic health conditions, how they really do interplay with one another, and how really being a holistic provider is so important in this area. I recently attended a conference by the NLN conference, and they were talking exactly about this, how there are lymphatic therapists and certified lymphatic therapists, and you'll see that with the SLT or Lana at the end of their name, like myself. And you will also see certified pelvic health therapists, and they have a board certification or a bunch of continuing education certifications underneath their belt within pelvic health, and how there is a merge between the two. So we're going to talk really briefly about how they interrelate. So for those that, feel free to take a peek at my other episodes when I talk about what is lymphedema. And a real brief overview is lymphedema is an accumulation of a very protein-rich fluid that's actually outside of the lymphatic vessel or outside of the lymph node for one reason or another. It works very much hand in hand with the circulatory system and with our immune system. And we need to make sure that our lymphatic system can drain that fluid appropriately, comes back into the vessel, the superficial, and the vessels that are right underneath your skin, travels along to certain lymph nodes that help connect to the deeper lymphatic vessels. It gets pumped through your system, gets to your kidneys. Your kidneys process that fluid one last time, dumps the waste into the bladder, and off you void. So your urine was once lymphatic fluid somewhere in your body. Your body has an amazing way of recycling things as it goes through. But for some reason, whether it's from surgery, from cancer treatment, from diabetes and weight gain, from a fluid overload like congestive heart failure, even pregnancy, can cause this kind of secondary lymphedema like venous insufficiencies, pelvic congestion. If you hear any of those terms, that can be a secondary cause of this backup of this fluid. There are some people that have primary lymphedema that are born, that are congenital, with less lymph nodes or a slower moving system. So it can be primary, it can be secondary lymphedema, but overall there is this congestion in the system. And what we visualize is an increase in swelling, an increase in circumference, whether it's around your arm, your leg, your trunk. And what we're going to talk about today is pelvic area, and how, yes, there's pelvic congestion, but how important pelvic health is, and we combine the two. So for example, a function of the pelvic floor muscle, we know from, prior podcasts, or if you hooked in with a pelvic health therapist, there are the main functions are helps with the urinary system, helps with your bladder, helps with the bowels, and helps with sexual function. And what's another function, and helps support those pelvic organs, and helps stabilize the skeleton or pelvis itself when these muscles do. And another big function that often isn't talked about is what we call our sump pump. And that is when the muscles in the pelvic floor act as a kind of suction, a sump pump to help move the lymphatic fluid that's within the pelvic region. Why is this so important? Our pelvic region, like I just mentioned, has these organs that are very important to our daily lives. Everyone pees, everyone poops, everyone should have pleasurable sex, right? Those are really important functions. If there is congestion, if there is extra fluid that is not being regularly stimulated and moved because we're not really using these muscles, then it's going to get stuck there and you're going to feel bloated. You're maybe going to have an increase in urinary frequency or potential leakage. It will be painful to have sex. It might be really hard to have a bowel movement because there's all this just extra stuff just literally hanging out there. So the muscles act like a sump pump to help drain those pelvic organs, your stomach, ovaries, testes, your GI tract, uterus, penis, your bladder, all those things right in that little area. They're so very important. The pelvic core muscles help to act as that muscular pump to get that lymphatic fluid moving. What's also really crucial and helps connect not just those with pelvic congestion with their lymphatic system, but even just lower leg congestion, right? Or if we have that lymphedema in our leg, I always teach folks a manual lymphatic drainage technique as well as perform it on them. And we always have to start at the trunk. We have to start in the middle of our body because that's where everything drains to. So for example, if you have swelling in your legs, we need to decongest what's above our legs, which is our pelvis, our lower trunk. We need to decongest that so that the fluid from the legs has somewhere to go. Makes sense, right? So if you listen to my podcast about lymphedema and what we do for conservative measures, one of that is the manual lymphatic drainage, and we decongest the trunk, and then we decongest the legs. And so if we follow the anatomy of the lymphatic system, it passes through the pelvis, which is so important. And that's often a missed area with lymphatic trained physical therapists and or CLT, is that we do maybe the leg stuff, we focus so much on that, but we never really hit the pelvis. And for those that are pelvic floor physical therapists and people are still complaining of this, like this pelvic pressure and this kind of bloating, and you capture all those other conservative measures, their hydration, their sitting posture, their breathing technique, their pelvic floor relaxation if they're really tight, or we're capturing all the things, but often we miss the lymphatic system in this area. That might be a cause or contributing factor to having that fullness, bloated pelvic pressure feeling that's still remaining. It's like for those that are out there listening to this, it's like we get them to like that 90% symptom resolution. There's still this like lingering little thing. Maybe let's take a peek at the lymphatic system. And if you are a lymphatic physical therapist, treat it. If you're not, refer out. Okay? Don't waste your time. Don't waste the client's time. And that is the best thing you can do for a client. So I'd come with saying if you have potential lymphatic backflow or this reduction in the flow, this congestion within the pelvic region or in the leg, and it's going okay, but it's the last little bit that's not really kicking it, we want to look up, we want to look at the pelvis. So for lymphatic therapists, if you are also trained to perform internal pelvic exams, this is a great way to take your manual techniques and apply that to the pelvis, because you know both. For those that are pelvic floor physical therapists that are also trained with manual lymphatic drainage techniques, perform that technique when you're at the pelvis to help out with that. So you may not necessarily do all the drainage of the extremity, but you can at least decongest the pelvic region. That will help with the rest of it. But make sure we know where we're at, practitioners out there, if you are one and not the other, that is okay. Know who those people are in your area. Because a lot of lymphatic physical therapists, we also were looking at wounds and things like that and doing bandaging. And so that's not your gig. Totally fine. You don't need to sit there and go off and get another certification if you don't want to, but know who your people are. So that way you can refer to. Same thing with pelvic health therapists. Or for lymphedema therapists, if they're not into pelvic health, totally fine. Know who your other pelvic health therapists are. So that way we can really achieve the maximum outcomes for our clients. And clients, do your research on those folks. I always screen, if I'm seeing a lymphatic client, I always screen pelvic health conditions. I have a one-page, super easy screening tool that I use. We just ask those questions. I'm not afraid of asking them, right? But I can just give them to the client. You fill that out. It's a real quick yes or no for 8 to 10 questions, nothing crazy, but that kind of helps. You know what? Let's take a peek at this just so that way we're capturing any and all contributing factors to your lymphedema or to your swelling. And if I am seeing a pelvic health client, I'm screening for any potential congestion in the system through their symptoms that they're having. So I am very unique where I am both. And so that makes me a definitely more holistic provider. And that doesn't mean everybody needs to go get both, right? But I want you to be empowered to really look at your providers, really making sure they're treating you holistically. And we're treating both the lymphatic system and the pelvic system. So for example, I had a client that was thinking they had lymphedema. Check out my other podcast of lymphedema and lymph differences comparison there. But they were thinking they had lymphedema, and we really have very similar symptoms of lipedema, lymphedema, and venous insufficiency. And pelvic congestion is venous insufficiency within the pelvis. And so oftentimes I'm always referring folks to check out their veins, make sure their veins are going okay, because the lymphatic system works with the veins. So if there's congestion in one area, there's going to be congestion in the other. And then we'll maybe capture these conservative measures to decongest the area. My one client, they were very consistently having a lot of potential pelvic congestion symptoms on top of having known varicose veins in their legs and heavy in their legs and easily bruising and all of these very textbook symptoms. And so I'm like, just get your legs checked out for the veins. And I always plant a little seed that if they know they have the higher veins in your legs, like femoral veins, greater saphenous, you'll hear all these words when you're talking to a vein specialist. But when there's seed stuff that's closer to the hip and pelvic area, they often will refer to or perform themselves an ultrasound on the pelvic area to check out the next level up to see if the pelvis is also congested. If the pelvis is also congested, there might be potential treatments like a little stent that helps reroute the blood there. And especially if you have more symptoms on your left versus your right side, just because of how our anatomy goes on that side, there's a higher likelihood of having pelvic congestion. So this one client, she ended up having very significant pelvic congestion, and she was postpartum by, I think, about like a year and a half, I believe. And she was looking at potentially going forward with lipedema surgical treatment or potentially trying for baby number 2. And so I'm not going to tell somebody what their decision is for expanding their family or waiting or any of that, but just we want to help set up the system for success regardless, right? So we want to make sure we decongestion the pelvic region, then her legs, and keeping going with that decongestion with the conservative treatment. And she also had pelvic health symptoms of pain with sex, urinary frequency. And once we were able to decongest the pelvic region, oh my God, those symptoms went away. It wasn't so much of a true pelvic floor muscle thing, right? Because her muscles were nice and flexible. She was able to engage them really appropriately and well. It was the fact she just had this congestion within that area. That pressure made her want to urinate more frequently. And also with literally that pressure, so whenever we have penetrative sex, it was uncomfortable. So we definitely need to be able, as providers, look at the whole picture. So look at lymphatics, look at potential symptoms, have the pelvic floor muscles use their function as a sump pump. Now, this does not mean that everybody needs to sit there and just do Kegels. This is why we want to make sure that you have an internal pelvic exam, so that way the pelvic floor physical therapist can check out those muscular tissues. Is there tension? Is there weakness? Are we coordinating there? Is there a postural thing we need to consider? Is there congestion? We want to make sure we are really assessing those pelvic floor muscles, so that way we're not just saying a blanket statement of everybody should do Kegels if they have pelvic congestion. Sometimes as a pelvic floor physical therapist, if someone has a really tight pelvic floor, they're not able to really engage all the muscle fibers because it's just as tight and bound down. So we have to help release or down train the pelvic floor muscles so that we can fully engage them in the isolated way to work on that sump pump action. Okay, hopefully that makes sense. So Kegels definitely have their place, and they're definitely needed to be that sump pump, but we need somebody to evaluate the integrity of those pelvic floor muscles to make sure we're not doing with tightness first, or as a really true weakness. So I just encourage my little therapists out there to really do their due diligence. And for those that are just lymphedema therapists, please don't try to pretend in this area. Pelvic health is a very important thing, and there is a lot of training that goes into that. So that way we are really treating these clients appropriately. We're not making things worse either by just saying, oh, I had 1 weekend course. No, you need to have ongoing training and continuing education and refining your skills before you go and do an internal exam on somebody, right? And then having those access points too, of if there is somebody that is assigned female at birth, that they have 2 access points, vaginal and rectal, to check out those pelvic floor muscles. For those that are assigned male at birth, they have 1 access point, rectal. So if you've only gotten 1 course and it was just for those with the vagina, we're missing half of the pelvic floor muscles, right? So we want to make sure we're doing our due diligence as practitioners and clients. I'm going to give you that little carrot 2 information, because you need to also vet your therapist out. That if they say, oh, we do lymphatic massage, is that main lymphatic drainage? Where did you go to school? Okay. It is okay to ask that. It is your health. You should be an advocate for your own health, right? So I have no problem if someone asks me, oh, are you a lymphedema therapist? Yes. Oh, what school did you go to? I went to Norton School of Lymphatics, and it was fantastic. And I do ongoing training. And so like these kind of things, we want to make sure that the client feels comfortable, but then also you are legit too. We're just not faking this. I just see a lot of clients after they've seen a therapist that claimed to be a pelvic floor physical therapist, and they were more exercise based, which is fine, when we totally missed the boat internally. And so we could potentially be making things worse. And I have to be like, okay, don't want to prove the last therapist, but we have other things we need to work on, other things we need to look at. So lymphatics and pelvic health really do go hand in hand. And there is some more research coming out, which I'm very excited to finally see and read, and just seeing the importance of how much these pelvic lymph nodes that only help drain the abdominal area and the pelvic area to help reduce leg lymphedema, but also genital lymphedema. So for those that have had any pelvic or abdominal surgery, for those that have had cancer and treatment in the area, genital lymphedema is not fun, right? For those that are assigned male at birth and have a scrotum, when your scrotum and testes enlarge, then that's not fun to be lugging around a huge bulk of tissue between your legs, right? Not fun at all. For those that were assigned female and that have labia, and to have swollen labia, isn't that fun either. So genital lymphedema is a thing that can absolutely occur. And so the pelvic lymph nodes help to decongest that area. Long story short, lymphedema and pelvic health really do go hand in hand. And here at North Star Physical Therapy, I am a specialist in both areas and love to combine them. So we're looking at the whole picture of the person. We're not just decongesting the legs, we're making sure we're really decongesting the whole system. And for those that are with public health conditions, we're looking at the lymph nodes to see, can some of these residual symptoms be because of this slight decongestion? So we really want to make sure we're looking at both. Clients and future clients, vet your clinicians and really make sure they know their shit. So you get the whole holistic picture. All right, guys. And until next time, feel free to email me or message me any questions or frequently asked questions. I look forward to be doing a podcast on those FAQs here soon. And so gathering them all. Or if there's a certain topic that you're interested for me to talk about, please let me know. And I'd be happy to share my medical knowledge with that or potentially having a guest on our podcast to help answer those questions. So I hope this helped to bridge the gap between lymphatics and pelvic health. And until next time.